365. Myself, Srija. Today, you will be able to learn about the ICD-10-CM code classification of diseases of the endocrine system. Okay? Yeah. Coming to ICD-10-CM. As I already discussed you about ICD-10-CM, I just recall you about in a short while. ICD-10 stands for International Classification of Diseases. It was developed by the World Health Organization, WHO. So it provides a standard system for classifying and coding all types of diseases and health conditions. So what is the use of ICD-10-CM? So the doctors, hospitals and medical coders around the world use the same language and it will be helpful for them to get coded. So this chapter, endocrine, nutritional and metabolic diseases. So this includes conditions that affect endocrine disorders, nutritional disorders and metabolic disorders. So what do you mean by endocrine disorders? It involves hormone producing glands. Coming to nutritional disorders, it is caused by too little or too much of certain nutrients. And metabolic disorders, it affects how the body uses energy and food. So chapter code ranging from E00 to E89 is all about the body's control system, the glands, the nutrients and how the energy is used. So if this system fails, you get endocrine, nutritional or metabolic diseases. So let's go into the classification. This slide explains how the ICD-10-CM system classifies different endocrine, nutritional and metabolic disorders into specific code ranges. Each range covers diseases related to hormones, glands, metabolism or nutrition. So the first classification, E00 to E07, disorders of thyroid gland. So in this section of codes, these includes conditions that affect the thyroid gland, which controls the body metabolism. For example, hypothyroidism, that is low thyroid, and hypothyroidism, that is overactive thyroid, and also the goiter, which is enlargement of thyroid. So these codes tell us about the problems in the thyroid, the gland that sets the speed of the body's metabolism. The code range of E08 to E13, that is diabetes mellitus. So this covers different types of diabetes where the body cannot properly use glucose. For example, E10 for type 1 diabetes, E11 for type 2 diabetes and also E13 for other specified types. So these codes show all forms of diabetes where insulin or sugar control goes wrong. So in the next code, E15 to E16, disorders of glucose regulation and pancreatic internal secretions. So this includes problems with low or high blood sugar but not caused by diabetes. Diabetes is already covered under E08 to E13. In E15 to E16, this includes the problems with low or high blood sugar that is not caused by diabetes. Other than the diabetes are covered in this section. So for example, hypoglycemia means abnormally low blood sugar. And the next code range E20 to E35. Here it covers diseases of glands other than the thyroid and pancreas. For example, acromegaly and also the Addison's disease. So this section it includes all other hormone making glands like pituitary, adrenal, parathyroid, ovaries and testes. Right. So coming to the E36, so this it refers to the complications of endocrine system that occur. So what complications and when? So when the complications occur during the surgery, so those are all coded within the E36 code range. For example, bleeding, injury during the surgery. And E40 to E46. So this includes the malnutrition, nothing but deficiency of nutrients, especially protein or calories. For example, E43 for severe malnutrition, whereas E44 for moderate malnutrition. So this group is about poor nutrition, nothing but not getting enough food or nutrients. So E50 to E64 code range. So these codes are assigned for the nutrition deficiencies disorders, or whenever the patient is diagnosed with nutrition deficiencies, so this code ranges will be assigned. For example, vitamin D deficiency or vitamin C deficiency. So E65 to E68 code range, it includes overweight, obesity and other hyperalimentation. Means it covers excessive nutrition or body weight problems. For example, obesity. This section covers the opposite of malnutrition because malnutrition is, yeah. So the section covers the opposite of the malnutrition. Here malnutrition, low food, whereas here too much food or nutrients. So coming to next code range, E70 to E88. These codes include conditions where the body has problems processing or breaking down the nutrients such as proteins, fats or carbohydrates. So metabolism means all the chemical reactions in the body that help convert food into energy. So when something goes wrong in this process, it causes metabolic disorders. So E89, post-procedural endocrine and metabolic complications and disorders not elsewhere classified. So this section includes complications that happen after medical or surgical procedures involving endocrine glands or metabolic systems. So that's what these are called as post-procedural disorders. For example, post-procedural hypothyroidism. So now let's go into brief discussion about the code ranges. So first, the disorders of the thyroid gland. Code range E00 to E07. The first code is E00. What is it? Congenital iodine deficiency syndrome. So what do you mean by congenital? Means present at birth. So which is already present at birth is defined as congenital. So these disorders occur due to the lack of iodine. Iodine deficiency means lack of iodine during pregnancy or affecting the baby's thyroid development. So this may lead to mental retardation, stunted growth or goiter. For example, congenital iodine deficiency syndrome, mixed type. So mixed type means, what do you mean by mixed type? Children born with both mental and physical symptoms of iodine deficiency. Okay. And next code E01, that is iodine deficiency related thyroid disorders and allied conditions. So these occur after birth. So the first one is congenital, by birth, and the next one is allied conditions, meaning after birth, and these occur after the birth and are caused by the lack of iodine in the diet. So commonly seen in areas where iodine intake is low. For example, E01.0, iodine deficiency related diffuse endemic goiter. So here the thyroid enlarges to trap more iodine. So the enlarged thyroid is called as goiter. So whenever this condition is diagnosed by the patient, so E01 must be assigned to get the accurate reimbursement, right? So the next code E02, what it is? Subclinical iodine deficiency hypothyroidism. For example, early hypothyroidism. So means, what is the meaning of this? This is a mild or early stage of hypothyroidism. Early means mild or early stage. Subclinical means symptoms are not obvious yet. So blood tests show abnormal hormone levels even though the person feels fine. So E02, it's an early or hidden stage of hypothyroidism due to iodine lack. So what's the next code? E03. E03, other hypothyroidism. So what covers under this section of code? Covers all the causes of underactive thyroid but not due to the iodine deficiency. Because it is not due to iodine deficiency, it is classified under E03 category. This may be congenital or acquired but not due to iodine deficiency. For example, E03.0, congenital hypothyroidism with diffuse goiter, means born with low thyroid hormone and also the enlarged thyroid. So what did you learn from this slide? Iodine is essential for the thyroid hormone production. So what does the deficiency of iodine leads to? Goiter or hypothyroidism. So E00 to E03 codes classify these disorders based on cause and stage, that is congenital, acquired or mild. Coming to next codes, E04. E04, other non-toxic goiter. So what do you mean by goiter? As I said you before itself, it's a meaning of enlargement of the thyroid gland. Here at the right side, you can see the picture of the goiter. This is the thyroid cartilage, thyroid trachea, and enlarged thyroid gland. So when the thyroid gland is enlarged, it is called as goiter, and this is the normal gland, normal thyroid gland, and this is the enlarged. Here you can see the difference in between the both, right? So this non-toxic means the thyroid is enlarged but hormone levels are normal. Only toxic means both it is enlarged and hormone levels are abnormal, but non-toxic means the thyroid is enlarged but hormone levels are normal. So there is no hyperthyroidism. It can occur due to growth of nodules or uneven enlargement of the gland. Here you can see the nodules. So this goiter is, it occurs due to the growth of nodules or uneven enlargement of the gland. So the next, coming to the next example, E05. What is E05? Thyrotoxicosis. So what do you mean by thyrotoxicosis? It's a condition where a thyroid gland produces too much hormones, that is T3 and T4. So this speeds up the body metabolism. So whenever the thyroid gland produces T3 and T4 more, production more, so this speeds up the body metabolism, causing the weight loss, sweating, tremors, and also the rapid heartbeat. So the common causes includes the Graves' disease or toxic nodules. So what is the point here? E05 is a overactive gland, overactive thyroid gland, right? E05 is the overactive thyroid code. That is, too much hormone makes the body speed up. So coming to the next code, thyroiditis. Thyroiditis. So what do you mean by thyroiditis? Thyroido means thyroid gland. Itis means inflammation. So inflammation of the thyroid gland is defined as thyroiditis. So what are the causes of thyroiditis? So formation of the nodules or inflammation, right? So this thyroiditis, it can be acute, short term, or chronic, long term, or long lasting. Sometimes it temporarily causes the thyrotoxicosis before becoming the hypothyroid or low hormones. For example, E06.2, chronic thyroiditis with transient thyrotoxicosis. It means E06 means a swollen or inflamed thyroid. It may be painful or cause temporary hormone changes. So whenever a patient is diagnosed or the record specifies thyroiditis disease, so E06, E06 code and E06 subcodes should be assigned. Okay. And coming to the next code, E07. What is E07? It indicates other diseases of the thyroid. Means it covers the thyroid problems not listed in the previous categories, such as genetical, structural, or functional defects. For example, E07.1, that is disharmogenetic goiter. So what do you mean by disharmogenetic goiter? Goiter which is caused by inherited defects in thyroid hormone production. So this E07, it includes rare or other thyroid problems like genetic enzyme defects. So whenever the disorders of thyroid other than thyrotoxicosis, thyroiditis, or non-toxic goiter, other than these, other than these, like this hormogenetic goiter is diagnosed by the patient or it is specified within the record, so assign E07 code. Okay. So here I already said you goiter is the abdominal enlargement of the thyroid gland, right? So which is located in the neck just below the Adam's apple. Here, so why goiter happens? Due to iodine deficiency, due to overactive thyroid, underactive thyroid, and also the nodules or cyst. I already said here the left side it shows a normal thyroid gland which is small and butterfly shaped. To the right side it shows an enlarged thyroid gland which is a goiter shape. So coming to the next core range of diseases, diabetes mellitus. So diabetes mellitus ICD-10 core ranges from E08 to E13. So what do you mean by diabetes mellitus? It's a chronic condition in which the body has trouble regulating blood glucose sugar levels. It occurs due to the problems with insulin, a hormone made by the pancreas that helps glucose enter cells for energy. Right? So you can see here a picture of the diabetes mellitus over here on the right side. You can see here the healthy pancreas, the type 1 pancreas and the type 2. In the healthy one, insulin attaches to the receptor, right? You can look over here clearly. Insulin attaches to the receptor so that glucose enters the cell and it produces the normal sugar level. This is a healthy one. Coming to the type 1, pancreas doesn't produce insulin. So glucose, as insulin is not present, glucose doesn't enter the cell. So the blood sugar rises, indicates the type 1 diabetes. Whereas in type 2 diabetes, pancreas produces insulin, but cells does not respond. In type 1, pancreas does not produces insulin, but in type 2, it produces insulin, but cells does not respond to the insulin. So glucose stays in the blood, resulting in the type 2 diabetic condition, diabetes mellitus condition. So this is all about this picture, diabetes mellitus. And coming to the classification of the diabetes mellitus. So this the ICD-10 codes E08 to E13. These are used to classify different types and causes of the diabetes and their complications. So what is the first code? E08, diabetes mellitus due to underlying condition. So what does it mean? This type happens because of another medical condition. This is not the primary condition. Here diabetes mellitus occurs due to the underlying condition, means already present medical condition. So because of another medical condition which is already present for you, such as pancreatic disease, hormonal disorders or genetic defects, nothing but it's a side effect. Here diabetes mellitus is caused by a side effect. So for example, E08.0, diabetes with hyperosmolarity. So what do you mean here? Very high sugar concentration in blood. So when another disease causes diabetes, we use this range of E08 codes. So these codes must be assigned, right? And next code is E09. Is nothing but drug or chemical induced diabetes mellitus. So this is caused by certain drugs or chemicals like steroids or toxins. So here diabetes mellitus is caused by taking of drugs or chemicals. So the pancreas or insulin function is affected by the medication you haven't taken. So for example, E09.1 with diabetes with ketoacidosis. So when the body breaks down fat for energy instead of sugar, it is named as ketoacidosis. Some medicines can damage insulin control. That's called as drug induced or chemical induced diabetes. So E10. Next coming to E10. What is E10? Type 1 diabetes mellitus. Already said you what is type 1 diabetes mellitus. The body does not produce insulin because the immune system destroys the pancreatic cells. As the body does not produce insulin, there is no formation of cells. The cells does not respond to insulin and there will be no glucose or energy in the cell, resulting in the type 1 diabetes. So this usually starts in childhood or adolescence. For example, E10.2. What is E10.2? Type 1 diabetic mellitus with kidney complications. So the next one, E11, type 2 diabetes mellitus. So what is type 2 diabetes mellitus? When the body produces insulin, but the cells does not respond properly, resulting in insulin resistance. So this condition is called as diabetes type 2. So this is common in adults and also often relates to obesity or the lifestyle factors. For example, E11.3. E11.3 is nothing but the type 2 diabetes with eye complications. What is the examples of eye complications? Like retinopathy. Retino means eye, pathy means disease. So disease of the eye. So in E11, the code E11, it indicates type 2 diabetes mellitus. So whenever a patient is diagnosed with type 1 diabetes mellitus, so E10 code is assigned. Whenever the patient is diagnosed with type 2 diabetes mellitus, E11 code is assigned, right? So whenever there will be a condition, there will be a situation where they doesn't specify what the patient is diagnosed with, what type of diabetes mellitus. So whenever there is no type of diabetes mellitus is assigned or is specified, whenever the type of diabetes mellitus is not mentioned, so take the default type is E11, the type 2 type. So next coming code E13 means other specified diabetes mellitus. So what does this code range includes? It covers rare or secondary types of diabetes which are not classified elsewhere. For example, E13.4. What is E13.4 code? Diabetes with neurological complications. So E13 is for other special causes that don't fit the main categories. So did you get my point? E08, DM due to underlying condition. E09, drug or chemical induced DM. E10, type 1 DM, and E11, type 2 DM, and E13, other specified DM. So this is the classification of the diabetes mellitus. And next coming to the codes of glucose regulation and pancreatic internal secretions. So these codes range from E15 to E16. So what is E15? So these codes are used when there are problems with glucose regulation or pancreatic hormone secretion. But the condition is not diabetes. I already said you clearly. Diabetes, the conditions of diabetes are only classified in the ICD-10-CM code range from E08 to E013. This code range E15 to E16 only for the problems with glucose regulation or pancreatic hormone secretion, but not the condition of diabetes. So coming to E15, it's a non-diabetic hypoglycemic coma. So what do you mean by hypoglycemic? Means low blood sugar, right? So it's a non-diabetic hypoglycemic coma. This code is used when a person's blood glucose drops dangerously low and it causes a loss of consciousness. Loss of consciousness is nothing but coma. So, but the person does not have diabetes. So, the person is not diabetes. So, the person has low blood sugar and the person feels the loss of consciousness. So, that person who is diagnosed with non-diabetic hypoglycemic coma, E15 code must be assigned. So next coming to E16 code. E16 is other disorders of pancreatic internal secretion. So this category covers other hormonal problems of the pancreas but not caused by the diabetes. For example, E16.0, the drug-induced hypoglycemia without coma. So some medicines like insulin or oral diabetic drugs, they can have the lower blood sugar too much even in the people without diabetes. so the person does not lose consciousness. Whereas E16.4 code, it is the abnormal secretion of the gastrin. So what do you mean by the gastrin hormone? The gastrin hormone, it is produced by the pancreas or stomach, which leads to Zollinger-Ellison syndrome. This causes the excess acid production and the ulcers. So E16, it denotes the problems in pancreatic hormone secretion like too much or too little insulin, gastrin, etc. So this is only core range for glucose regulation and pancreatic internal secretion. So this is all about today's session, guys. In the next session, we will be learning about the ICD-10 CM codes and their classification. Thank you.